Good afternoon, everyone. Thank you for joining us for the lunchtime seminar. So we'll get started in a second. So my name is Chris Ludlow, and I'm a clinical psychologist and I work at Swinburne University. I'll be largely taking the session this afternoon and telling you all about the great work that we're doing here at the Swinburne Psychology Clinic. So Maja is my colleague, and I believe that she's there. Are you there, Maja? So Maja might just be getting her microphone on. I'll just give her a second to get her microphone on. So Associate Professor Maja Nedeljkovic, I believe she is there in the background. So she'll be joining us, and she might also be commenting as we go through the presentation. So she's the clinical director of the Psychology Clinic. But what we'll do is we'll get started. I can see that there's a number of people who are attending today, so I really appreciate everyone's attendance. I can understand that this is an issue that everyone is very interested in at the moment because of the COVID situation, unfortunately, here in Australia and across the world. If there are any questions because of the numbers of people, what we might do is just leave that for the last 10-15 minutes of the presentation. So I'll open things up and people can ask their questions about the program. Okay. So, what we're talking about today is cognitive behaviour therapy for pandemic-related anxiety and depression in youth. And the main purpose of the presentation or of the webinar is to discuss this evidence-informed treatment model that we're using at the Swinburne Psychology Clinic. So there's a number of reasons why we want to talk about this treatment model. Firstly, I think we're doing some really good work at the clinic, and I'd like to talk about some of that good work. But the actual treatment model itself has been informed by evidence and by theory. And I thought it'd be a good opportunity to have a broader conversation with the community about the treatment model for people to play around with it and see whether or not they can use that in their practice. So I think Maja is there now. Maja, did you want to introduce yourself? So Maja, you have your hand up, but I'm not sure what that means. Okay. If there's any problems or concerns during the seminar over the next hour, just place them in the group conversation. Okay, we'll get started. So this is an overview of the session this afternoon. So we'll talk about the program's aims and rationales. So why did we put this program together? We'll talk. Oh, Maja, you're there. I can see you now. Do you want to introduce yourself?
I hope that people can hear me. I could hear everything, but I could not seem to get a response. So
I can see and hear you now, Maja. That's fantastic.
Apologies, everyone. We had some technical issues. I'm not quite sure how it started working, but it did. So welcome, everyone. My name is Maja. I'm the Director of Psychology Clinic, and I'll be jumping in from time to time in this session. But I just want to say thank you to Chris for setting up this seminar and providing this information about this very important program.
Thank you, Maja. I really appreciate all of your support with this program, and it's really great that I could see and hear you as well, because it suggests to me that other people can hear me and see me. Okay. So please tell me, Maja, if there's any problems with my microphone or if there's any technical difficulties. Okay, we'll get started. So as I was saying, we'll just talk a little bit about how the program came about, what the rationale is behind the program, We'll discuss briefly what the referral criteria is, because we're working with adolescents aged 13 to 18. So we've got a very specific population. And then I guess the main focus of the presentation is talking about the treatment model. So there's different components to the treatment model, and the key part that I want to focus on today are the psychological principles that underlie the treatment model. There's 3 key psychological principles that I really want to talk about today. They have greatly informed the intervention, and so far with the work that we're doing with the cases that are coming into the clinic, it seems as if those key principles are quite relevant for young people who are distressed about the COVID-19 situation. So I'll spend most of the presentation today talking about those key principles. And as we end today, I'm going to talk a little bit about some just initial service data. So we've just got a little bit of service data because we've only just started taking on referrals, and then discuss a case example. So I know some people put their hands up sometimes. I'm not sure if it's a mistake, but I'll just keep on ploughing through. And if there's questions, then we can answer those questions at the end of today's seminar. So the rationale behind the program is quite obvious. We're all concerned about the current impact of the COVID-19 situation on the population. In particular, young people are a vulnerable group within the community. And so we thought, how can we find a way of putting together what we know works in mental health, so that we can find a way of helping young people through this crisis. So there's a little bit of research already looking at the impacts of the COVID-19 crisis on adolescent mental health. And, you know, this is all very preliminary. We don't really know what the impacts are, but there have been a number of studies that have already been published this year. And definitely one thing that we do know is that the COVID-19 crisis increases and elevates levels of symptoms. So in particular, this one study that was done in China looked at the impact of COVID-19 on youth. And they found that this age category, 14 to 20, had the highest levels of psychological distress out of any of the age categories. So, I mean, there's a lot of people doing a lot of great work out there at the moment with young people who are distressed COVID-19 situation. And so there's going to be diverse range of models and ways of working with young people. I guess the first thing that jumped to my mind was that I have a particular interest in how we can apply scientific psychology to solve real world problems. So I thought, what does the research say about how people cope during pandemics and during epidemics, and how can we use that information to help young people through this current crisis at the moment? So I love this particular quote by Kurt Lewin. I remember learning about that in this quote in my undergraduate degree many years ago, that there's nothing more practical than a good theory. So that's a key principle that's underlied this particular intervention, is how can we derive the theories on how people cope during pandemics and use that to help people. And so that led to developing the CBT for pandemic-associated anxiety and depression. So every intervention needs a really cool acronym. So Maja came up with the CBT PDAS. So I love the acronym. So when I say CBT PDAS, I'm referring to the program that's operating at the Swinburne Psychology Clinic. So this is the Swinburne Psychology Clinic at the university. So it's a really beautiful campus university. I'm quite new to the university myself. And so the clinical psychology students are training to be psychologists, and they see their cases at this clinic that you can see here. Do you want to talk a little bit about the clinic, Maja, and sure. so that people who aren't familiar with the clinic and also the training of clinical psychologists can understand?
So we are a student-run clinic. So all of our clinicians are postgraduate psychology students. They're in their 5th or 6th year of training. So nearly all of them are in their 5th year of training. And they come from various backgrounds. As part of our requirements to enter the course, many of them would need to have experience in the mental health field or social or service field, clinical service field. So while they might be student clinicians, many of them have quite extensive experience before they come to us. So, they are all supervised by our senior clinicians, many of whom have extensive expertise in a range of areas and are conducting research and developing new treatments like this one, for example, and evaluating those treatments. We also run lots of professional developmental seminars, which have slowed down due to COVID, but we are restarting. This is one of the very first one, and lots of other programs. So if you're interested, please visit our website. It's listed there, and have a look at some of the services that we offer. We are low-cost service for the community, in that we try to make the service accessible and affordable for all of our clients. Yeah.
Thank you, Maja. Thank you. Really appreciate that overview. So this is the CBT PDAS team. Here are some of the intern psychologists that are working on the program, and they're really wonderful. They're doing a great job in supporting young people during this crisis. So I meet with this team on a weekly basis to provide group supervision, and the interns also receive individual supervision as well on their cases. So I'll just talk a little bit about the referral criteria, so the types of cases who are coming into the program and the types of cases who can be referred into the program. Essentially working with kids who are from the ages of 13 through to 18. And we're working with cases that have mild to moderate anxiety and depression. So that anxiety and depression could be directly related to the pandemic. So an example might be fears of getting COVID-19 or fears that someone in the family member might get COVID-19 and get sick. So we work with some of these cases have very direct fears of COVID-19. But we're also working with cases who have anxiety and depression that started during the pandemic, or it was exacerbated during the pandemic. So an example of that, like a common example, relates, for instance, in Melbourne with the lockdown. That has been quite disruptive for a lot of families and young people, as you could imagine. So a lot of young people had a lot of hopes, dreams and goals and social activities and sporting activities they once engaged in. They can no longer engage in those things anymore. And so that's having an impact on their well-being. So it's quite a common referral, that particular issue. And we'll talk a bit about that when it comes to the theory that underlies the program, because one of the hypotheses that we had is that the lockdown environment would have an impact on young people's mental health. So just generally, what the young people receive is a package of care that consists of an assessment. Some young people come into the program with elevated risk levels, and so the first few sessions might actually be safety planning and containment before they actually start their therapy. So make sure that all risk issues are managed right at the beginning. Once there's been containment and safety planning and assessment, the young people will receive 6 sessions of what we're calling low-intensity cognitive behaviour therapy, and I'll talk a little bit about what exactly that is as we go along in the presentation. The young people also receive access to a website that contains psychoeducational materials and self-help materials. A key thing that we emphasise in the program is parental involvement. So this makes the CBT developmentally appropriate because young people often require involvement of the parent in order to get a good clinical outcome. And so this is the overarching framework. So just talk a little bit about this before we actually go into the theory that underpins the intervention. So the overarching framework, though, for the program is based on this concept of low-intensity cognitive behaviour therapy. As you can see, there's a meta-analysis down the bottom there by Bennett in 2019, and essentially, you know, there's emerging to strong evidence now that that young people can respond to low-intensity interventions. But those low-intensity interventions, for them to be effective, need to be a package of strategies that include the direct therapy, but supplemented by like self-help and psychoeducation. We're also delivering this intervention through telehealth, obviously because of the COVID-19 situation and the current lockdowns in Melbourne and Victoria. So just to emphasise this point, so even though it is low intensity CBT and it's a telehealth intervention, it is a formulation-based intervention, it's individualised, so the psychological therapy is delivered by the same therapist from start to end, which allows the young person to develop a therapeutic alliance with the therapist. Do you want to say anything about that, Maja? Because Maja works, you're involved with mental health interventions, so mental health online. Do you have any comments about that? Because there's different models for delivering online treatment. So this one's a little bit different to some of the other ones that are out there. So what is the difference?
Yeah, so the main difference is with many of the structured online programs, what usually is delivered is a structured web-based program which the client can work on their own with the guidance from the therapist. So that's more like guided self-therapy, whereas this particular program, what we really try to do is use telehealth as a platform for engaging the young person in a counselling, on one-on-one counselling with a therapist, and using the website as a helping, as an additional resource. So we're trying to blend the two to maximise the benefit of the therapeutic alliance and flexibility that can be offered. So to individualise the treatment program for that particular individual, and then pull out from the website the important bits of information. I think that there were a couple of hands there. Right.
Are we going to leave the questions until the end, Maja, or?
Yeah.
Yeah, we'll leave the questions there. I think they're just accidental. I've noticed a few of them going on. But thanks for the clarification, because I think it's something that some people have not found to be clear initially. They've wondered if it's more like a computer-based CBT. So there's an aspect of that, but there's definitely a therapeutic component where the young person meets with a therapist and they receive 6 hours of direct counselling. So this is an overview of the session structure. I mean, there's nothing overly remarkable about this session structure. You can see the themes. It's very standard low-intensity cognitive behaviour therapy. I'll just draw your attention to some key areas, though. So in the second session, there's a strong focus on behaviour activation, and that behaviour activation is done generally in conjunction with the young person and the parent. So if you're looking at the application, so behaviour activation therapy, essentially, for people who aren't familiar with that, is a way of improving or increasing activity levels for a young person who is depressed. It's also about trying to increase the rewarding sort of nature of the environment around the young person, because we know that when the environment is rewarded, so it's quite a enriched environment, that young people and adults, their mood is better. So essentially what we're hypothesizing here is that the lockdown environment has an impact on how rewarding an individual's environment is, which then has an impact on their mood levels. So essentially behaviour activation therapy is a really important component of this intervention. So even though it's mentioned in the second session, there's elements of the behaviour activation therapy that continues throughout every session. So it's a really key element. And so we'll talk a little bit more about that as I talk about the theory that's behind the program. Another component to this is also looking at the cognitive and the problem-solving strategies. And so again, I'll talk about that when I talk about the theories in subsequent slides. So this is just the example of the website, so the young people get access to the website. And I'll show you examples of some of the content that's on the website as we go through. So essentially the website, it contains psychoeducation and self-help materials. All of the young people coming into the program get a very comprehensive assessment. So they get a mental health assessment, also are assessed with these psychometric tools. And so all of these psychometric tools have been very carefully selected because they relate to the theory that underpins the intervention. So just an example, I think I've got a pointer here actually, I just pulled my pointer up. As you can see, one of the scales that we administer to the young people looks at something called Behaviour Activation for Depression scale. And essentially that tells us how withdrawn the young person is. And so if an individual is very withdrawn, then that's an opportunity to deliver the behaviour activation therapy, because we want to make sure the young person is getting out of bed more often, that the young person's talking to people around the house more frequently, the young person's able to contact friends through Skype or whatever it is that they use on their phones. So essentially this is an indication of the level of withdrawal, and that then allows us to shape therapy and to individualize the therapy for the clients. Another interesting measure that we're using is called the Fear of COVID-19 scale, which is a new scale that's been developed, and it assesses specifically an individual's fear of COVID-19. For instance, will I get sick? Will family members get sick? So we get a real sense of, you know, what's happening for this individual, this client as they come into the program. Are there fears and anxieties general? Are they about, you know, homework? Are they about, you know, problems with friends? Or are there some specific COVID-19 fears? So that's the purpose of these assessments. Some of these other scales, I'll talk about them as we discuss the theory that underlies the program. But something else that's just worth commenting on is that another framework that we've integrated into this is this concept of feedback-informed therapy. So there is a lot of research around now, going right back to research about 20 years ago, Michael Lambert, who showed that when we use these scales, these psychometric tools, and we give feedback to our client, that these tools can actually be therapeutic. The feedback can actually improve the effectiveness of the therapy. So at each stage of the program, different psychometric tools are used in the therapy as an opportunity to give feedback. So I'll just lead you through a few of those examples. I've got my pointer out again. Hopefully you can see the pointer. In the first session, the young person and the parent is given feedback on the symptom measures. And as I was saying with the behaviour activation scale, the young person is given feedback on that scale in the second session. So if they have behavioural withdrawal, then the therapist highlights that with the use of the scale to the young person, which then allows the therapist to match the behavioural activation strategies to that particular symptom. In the third and the fourth sessions, those sessions are around formulation and around cognitive work. So we have a number of these cognitive risk factor scales. So the two ones that we're using in the program are the obsessive beliefs questionnaire, which is a questionnaire that looks at the types of beliefs that individuals with obsessive compulsive disorder have. So these are risk factors for obsessive compulsive disorder, but this particular scale is also known to be a risk factor for other forms of anxiety as well. The other scale that is used is this one here, which is the intolerance of uncertainty scale. I'll define exactly what that means in a few slides. I've got some specific examples on that. But essentially the key point is that the young person is given feedback on these scales because we know that that is therapeutic and it guides the intervention as well. And it's a key component to having a feedback-informed approach. So what I'm going to do now, after I have a little bit of a drink, just give me a sec, just have a drink, my mouth is dry, is I'm going to talk about these principles, these key 3 principles that underpin the program. I think this is the main takeaway message I would like people to get from the webinar today, is that looking at the literature, why do people become anxious? Why do people become depressed during a pandemic or during an epidemic? There is a history of looking at anxiety and fear during pandemics and epidemics within the literature, going back to the HIV/AIDS crisis in the 80s. There's also an examination of the impact of SARS and the swine flu as well. So there's a history of looking at these psychological risk factors in the literature. So we've tried to identify these and integrate them into the program. A key principle, though, is that this isn't just a pandemic or an epidemic, it's also just a general crisis. And so we've tried to look at, well, what are the key factors that help people get through a general crisis? So after looking at the literature, we've come up with these 3 key principles. So one is that lockdowns potentially place youth at risk of a low reinforcement environment. So we'll talk a little bit about in a second about what that means. The second principle is that intolerance of uncertainty, which is a cognitive factor or cognitive variable, and obsessive beliefs are psychological risk factors that predict anxiety during past epidemics and pandemics, and also during the COVID-19 pandemic. So I've got some research on that. We'll discuss that in a moment. The third principle doesn't relate to pandemics or epidemics. It's more just this issue of, well, what helps people get through crises? And so there's some interesting research looking at how effective problem solving protects youth against depression and anxiety during a crisis. So these principles underlie the program, and I'll show you how they are expressed through the psychoeducation and the way that the low-intensity CBT has been structured. For people who are interested, if you want a little bit of a review of some of this literature, this is a wonderful textbook by Stephen Taylor. This was actually released before the COVID-19 pandemic, 2019. And it's basically talking about, well, what happens if there is a pandemic? How will people cope? What will society do? What would be the most appropriate health responses? So Stephen Taylor wrote this before the COVID-19 pandemic. So it's a really wonderful text, and I highly recommend it. So let's just look at this first principle around lockdowns having an impact on young people. So we're certainly seeing this with the young people coming into the program. So that the stories that young people and families are telling are often around this particular, we're working here in Melbourne, obviously, around the impact of the lockdown, how it's cut the young person from their friends, from school, from the things that they used to do. And obviously, many young people and adults are resilient and they can find ways of reorganizing their lives. But some people are more vulnerable and they become overwhelmed by these experiences. And so we're hypothesizing here that the lockdown environment places young people at risk of what is a low reinforcement environment. So that's just a fancy way of saying that when you're stuck at home, there's not much fun in your house compared to when we're allowed to go out and do things. I know that for myself, I used to love going to the mountains and hiking and bushwalking and all of these types of things. And now I'm just stuck at home. And that is it's not as rewarding, that environment. And for young people, they're experiencing a similar thing as well. So for many of us, we're not going to necessarily develop a psychological disorder because of this. But this is a stressor, and we know that looking at the research that these low environmental reward environments are associated with the onset and maintenance of depression. But from a treatment perspective, this is quite positive because behaviour activation therapy is the key strategy for intervening here, as far as we see in a lockdown environment, because it's very practical. The therapist goes into the household, at least through the telehealth, and talks to the young person, talks to the family, and gets the family and the young person to think about ways that the environment in the household can be more rewarding, that there can be more activities, and to plan that, to structure that. So it sounds like a very straightforward, simple idea, which it is, but actually getting that up and running in real life is a challenge. And that's the purpose of having therapists there. They motivate the young person, they motivate the family, and educate the young person and family on the importance of doing this. And then they guide and set goals to try to find ways of slowly activating the client so that they're able to fight off the depression and the withdrawal that's associated with low mood. So this is a really good article, if you see this one here by Pass. So there are studies looking at behaviour activation therapy within adolescent populations. So I highly recommend these two papers here by Laura Pass. And the interesting thing about her intervention is it does have a large family component. So involvement of the parents with behaviour activation is really crucial in making it work from my clinical experience. And that's what we're trying to emphasise here in our program as well. So this is just an example of how this principle, this psychological principle, is then translated into the psychoeducation on the website. So the young person reads this. It's both psychoeducation and a rationale for the intervention. So it just says here that an unrewarding environment impacts our psychological well-being. And I'll just read a section of this out. It says, there are a range of scientific theories that explain depression and anxiety. But one important theory is called the reinforcement theory, and it attempts to explain depression and anxiety as the consequence of an unrewarding environment. Okay. So the second principle looks at the cognitive risk factors for developing anxiety during a pandemic or during an epidemic. And so looking through the literature, there's a range of these variables, but two really stand out. And one is called intolerance of uncertainty, and the other one is called obsessive beliefs. And so these are psychological risk factors that predict anxiety during pandemics. So just as an example, like there's been a number of studies done recently looking at the correlation of intolerance of uncertainty and fear of COVID-19. And going back to the swine flu pandemic, there is a series of, large-scale studies looking at the correlation between obsessive beliefs and fears of contracting swine flu illness. Now, I'll just define a little bit what exactly we mean by some of these terms, and I'll show you how that gets translated into the psychoeducation that's used within the therapy. So intolerance of uncertainty. So essentially, this is a cognitive risk factor. And I guess none of us like uncertainty. But for people who are high on this risk factor, they find uncertainty very difficult. And so I'll just give you an example. I've got some examples here, but these were good examples of what someone might experience during the COVID-19 pandemic. So there's a lot of uncertainties, not just in life, but certainly with this current pandemic. So I don't know, for instance, if my friend has washed his hands if I meet up with a friend. So there's a degree of uncertainty there. I don't know if I go to the supermarket who is infected and who's not infected with COVID-19. So again, there's a degree of uncertainty. If I don't know if I do get COVID-19, if I'm going to get really sick, or if I'm just going to get a mild form of it. So again, another uncertainty to be living with. Now, we all live with uncertainty and we all find it uncomfortable, but people who are high on this cognitive risk factor find this uncertainty to be very difficult and anxiety provoking. The other risk factor that we're talking about here are obsessive beliefs, and there's a range of them that we're measuring in the program. But essentially, these are beliefs that are correlated with obsessive compulsive disorder. An example of an obsessive belief is what we know as perfectionism. And so I've got these definitions here in the psychoeducation. I'll just read this out. This is what the client would see, the young person would see when they go onto the website. So it's both, again, psychoeducation and also a bit of a rationale for engaging in the cognitive therapy side of things. So this is under like a heading of unhelpful thinking styles. So thinking styles that increase your anxiety during a pandemic. So this is a definition of the intolerance of uncertainty. We have limited control over the world. Some people find this frightening because they want certainty before they act. But many of life's situations are uncertain and difficult to predict. The COVID-19 situation is particularly challenging for people who find uncertainty challenging. There are many uncertainties during an outbreak. For example, will I get sick? Are people around me unwell? Is it safe to return to school? Will everyone be wearing a mask? People high on this trait can sometimes employ perfectionism as an ineffective coping strategy to deal with uncertainties. That is, they might try to find the perfect solution to avoid danger. In the current context, this can lead to unrealistic and excessive efforts to avoid COVID-19, which can lead to anxiety when things don't go the right way. So for instance, I can only leave the house if I'm wearing many pairs of gloves. Although it is hard, finding a way to live with life's uncertainties helps in the management of anxiety and fear. So it's just a way of defining intolerance of uncertainty for the young person. So this is psychoeducation. It'll be part of like their homework to read this and to then discuss that in the session with their therapist. The therapist also has the psychometric test score. So the young person's filled in the questionnaire on intolerance of uncertainty, and the therapist might give feedback on that particular questionnaire in the therapy to raise awareness and to start that conversation. So the third principle is a straightforward principle around problem solving and how problem solving has been shown to protect young people against depression and anxiety during a crisis. So there's a whole heap of studies out there that demonstrate this particular finding, but I've just pulled out this really interesting one by Spence. It's an Australian example. So there's this term that's used, it's called negative problem solving, negative problem solving orientation. And essentially, negative problem solving orientation is just this concept that some people are really confident about their ability to solve problems, and other people are very pessimistic about their abilities. So it's not necessarily about their problem-solving skills, it's much more of a confidence issue. And so that's one of the things we're trying to target in this program, is to try to lift the young person's confidence that they know how to solve problems, life problems we're talking about here. So some of these studies, so this one study here is really interesting because it looked at negative problem solving orientation as a vulnerability factor for adolescent depression, but only in the presence of a negative life event. And there's a range of studies looking at how problem-solving therapy is helpful for adults and adolescents when they're experiencing depression. So it's a key idea, this idea of problem-solving skills, but more around the confidence that an individual has in their ability to solve problems, which really protects them when they're exposed to a crisis such as COVID-19 being a crisis. So what we have here again is just more psychoeducation that the young person would read through before they attend the session, so that they have an understanding of this issue, but also it's a rationale for engaging in the problem-solving therapy. And so it says here that scientists have a name for people who have a pessimistic view of their problem-solving abilities. They are said to have a negative problem orientation. It says that research consistently has shown that maintaining your confidence while solving problems reduces the impact of stressful life events and makes you less vulnerable to mental health difficulties. You may face many new challenges and problems during the COVID-19 pandemic. As such, those who are confident problem solvers during the crisis will cope better and have less anxiety and depression. So just a general comment here too, is that as you can see, there's no reason why standard CBT wouldn't be helpful for young people who are experiencing anxiety during this current pandemic. But this particular intervention is being carefully tailored so that there are these COVID-19 themes and pandemic-related themes. And so for some young people, they find that to be quite helpful because it's individualized. We do also discuss broader issues. So some young people bring in broader problems around stress that they might be experiencing, for instance, with school, with their schoolwork. It may not be themed with, it may not have COVID-19 themes or pandemic-related themes, their anxieties, but they're anxious about schooling. And that could be because of the disruption that has happened. They're now doing online learning, they're at home. And so we work with that as well. We don't just ignore anxieties that are unrelated to COVID-19, essentially is what I'm trying to say. This is an example of one of the worksheets, which is a standard problem-solving worksheet that you'd see in CBT. So I just want to talk very briefly about some of the initial data that we're seeing coming into the program. It's quite interesting that when you're looking at the data that the main symptom that emerges with the cases that we're getting referred is depression. So we use something called the ARCADS, which is a valid and reliable instrument for measuring anxiety and depression in youth. And so on the ARCADS, you can see here, we have 75% of this particular sample are scoring in the clinical range or an elevated range for depressive symptoms. The second elevation is around separation anxiety. And so when we look at the themes with the young people, those themes are often about worries about mum and dad who are still going to work, as an example. And just to draw your attention to two other things. One is that about 40% of this initial sample that we have here, because we only just started receiving referrals over the last 2 months. We have about 40% they're elevated with their behavioural withdrawal, and about 40% have specific elevations around fears of COVID-19. So just a brief case example, and then we'll open it up for general discussion. So this is a young person who completed their 6 sessions of therapy, and essentially this is a 16-year-old. We've changed elements of the case just to protect their confidentiality. This young person was anxious about COVID-19, so COVID-19 anxieties, but also upset about the loss of athletic and sporting opportunities because of the pandemic with lockdowns and things of that nature. And as you can see, at the start of the therapy, they were in an elevated range for their fears of COVID-19. And then at the end of the intervention, it dropped down to a normal range. Same with their intolerance of uncertainty scores, dropped down to a normal range. At the start of the therapy, we use a really great tool called goal-based outcomes, which just captures what the young person wants from the therapy, and they improve, so they move towards their goals. And there was a reduction in psychiatric symptom scores from the start to the end of the therapy. And just to mention, sorry, just to mention this, I need some water. Talking too much. Just to mention this elevation here on the perfectionism subscale, it just shows how we use this data, is that we're not using this particular scale to track the effectiveness of treatment. We're using it for formulation. And so this particular young person had, I guess, elevations in perfectionism, and that was playing a role in their distress with their anxiety. And so that was used in the formulation session to raise their awareness. And so the young person gave feedback and said, I'd like to thank everyone a part of the program. I and my family can see a difference in my mental health from the past 6 weeks of doing the program. So it's just nice to get a little bit of feedback from one of the young people who have completed the program. So if people here are either in clinical services or schools and things like that, you might actually know a young person or a family who could benefit from this program. So we're still receiving referrals. So please feel free making referrals. For the first 2 months, we offered this as a free service to the public. And the service, offers low-cost therapy. So at the moment for this program, it's $10 per session, plus $10 for the assessment. So if you want to make referrals, you can do that in 2 ways. You can just go to the Swinburne Psychology Department's, or it's the clinic's website actually, and you can find an online referral form. Or secondly, there's this particular online referral form as well. So if you click on that, then it allows you to make an online referral into the program. With your webinar link that you were sent recently, you've been sent that particular referral form. Okay, so we have about 10 minutes. And so I'd like to just thank you for listening to the didactic component to the presentation. So what I'm going to do now is open it up for people who would like to ask questions. If you can ask questions in different ways, you can put your hand up and turn your microphone on, or you can put a comment in the message. There's a chat section. Yes. So I've got a hand by Daisy. Do you want to turn your microphone on, or do you want to put something in the message area?
I'm just wondering, Chris, whether there might be some issue because I had trouble getting heard or write anything in the message area when a couple of times I joined. So
it could be because it's a large Collaborate session, and when it goes over 200 people,
I actually changed the browser. So I went from Safari to Google Chrome, and that seemed to work. So if you can copy the link at the top and enter from Google Chrome, I think that's helpful. That did the trick for me.
Yeah, so you need to be in Google Chrome. Just seeing if I can take this link as well. Does not work. Right. So what I'm going to do is, so I'm not sure if people can actually comment. I'm not sure what that's about. But what I've got here is just a feedback form about the seminar. And I'll put that in the chat section. And I'll also put a copy of the referral form in the chat area as well. So I noticed that someone sent me an email about it says that the chat is closed. Okay, so I'm sorry about the chat being closed. I'm not sure why that is the case. Yeah, I could quickly see if in the settings, if I can turn it on.
There is one chat. Yes.
Okay.
Working. Yeah.
That's working now, probably because I posted something. Okay, there we go. Thank you.
Yeah.
That's great. Okay. Oh, someone wants to see the problem solving sheet again. Yeah, sure. And no, you don't need a mental health care plan to refer to the clinic.
At the moment, there is
Yeah.
no wait list, but depends on the influx, I guess, if that happens, that might be the case. Yes, we will accept referrals from New South Wales.
The age is 13 to 18. This
Yeah.
is the problem solving worksheet that someone asked about before.
Okay, so there was a question about novel behavioural activation suggestions in lockdown.
So in lockdown, well, one that comes straight to mind, it's a really cheesy one, and I think it's good because one of the interns used my suggestion the other day. Sometimes cheesy is fine because it leads to laughter and then the young person can develop their own. But I suggested to the intern that they have a chat to the family about board games. And I honestly thought the young person would just laugh at the intern and then they'd have a fun conversation about doing something cooler than that. But actually led to them playing board games. And apparently that had a really, really positive impact on the family because behavior activation, although it is a behavioral, it has a behavioral theory behind it. There's so many other things going on as well, like emotions and relationships between people. So if you can encourage social activity in the household, then that definitely has a huge impact on the young person. Someone was talking about behavioral activation with a young person last night. So yes, oh yes, Maya, yeah.
So I will just be answering as many as I can of these, but there was a question about the scales. They are freely, all of the scales we're using are freely available. And if you have trouble locating them, please let us know and we can direct you.
Yep.
Is there
and
any...
I think we'll put these slides on the website at some stage too. Is that correct, Maya? Are we able to do that?
Yes, we can. It depends. We can put a link to access the video recording of the workshop on this clinic website.
And I can put the slides with that link if people want to see those scales.
Yes. Now, a few of you had questions about referrals. Teachers can make a referral, although we will need to have. It's best to ask the parents to contact the clinic, basically. How payments made? The payments can be made through a credit card, or they can be a direct transfer, and we can facilitate a single payment for all the sessions or session by session.
So Aisha asked a question about about trying to assess the rewarding nature of the environment. So yes, there is a particular measure on that. And I'm just trying to find the name of it right now.
Thank you.
It's called the EROS, but I'm not sure what that stands for. It's a 10-item measure that assesses the environmental reward and behavioural consequences associated with response contingent positive reinforcement. So I can send that through to you later, Aisha, if you send me an email. Just try to see what it stands for. Oh, it stands for the Environmental Reward Observation Scale. So not living with parents, I don't know, Maya, like at the moment, do you want to comment about that? Because we are generally requiring parental approval, just because my understanding is because of the nature of the clinic, we don't have like a crisis team and stuff like that. We need to put some sort of processes in place to minimise some risks. But do you want to comment about that, Maya?
It really depends on the young person's circumstances. So if they are classified as mature or minor, then we can self-refer. Because we are conducting all sessions through telehealth, we do require next of kin or a health worker. So a youth worker as a crisis contact would be an appropriate contact. So yes, they can be referred as long as they can be considered as mature minor.
Okay, that's good. Good to get that clarification.
How the therapy sessions arranged with the young person. So we actually, our clinic operates between 9 a.m. and 9 p.m. on Monday through to Thursday, and 9 till 1 on Saturdays, and 9 to 5 on Fridays. So there is quite a bit of flexibility in terms of the times. And we have a pool of therapists, so there is a reasonable flexibility in terms of when sessions can be made.
And so just to comment on the one-on-one treatment, so we do have some of our clients, they have other mental health treatment providers. And so what we try to make sure is that the intern liaises with those treatment providers, and tries to make sure that the work that the intern is doing is targeted to the pandemic-related anxiety and depression, so that there's not an overlap with the other provider. So it's a collaborative approach. So it's not a problem if there are other people involved in the young person's care already. And it's our approach to make sure that we collaborate with those other professionals and send things out like letters to inform them that the young person's in treatment at the psychology clinic.
Thank you.
Okay.
Yes, a bit of the there was a question whether the psychoeducation component is available on the website. Yes, it's available, but the therapist will discuss that with the client, and the website is there to refer. And as a handout, what would be a handout in a face-to-face situation, the client will have that as a referral source, and they can read it before the session. It's something that they can read after the sessions, and it's discussed in the session.
There was a question about negative problem orientation before, and it's something about is there a genetic or biological component to it? I don't know. I mean, there often is with a lot of psychological variables, but I do know that it's a dynamic variable in the sense that it can change and it does respond to treatment. So if you're looking at negative problem orientation, it tends to decrease during cognitive behavior therapy, and that's with adults and also with youth. Okay, so it's 2 o'clock.
Yes.
Thank you everyone for attending today. Just another question, do you work with clients with other diagnoses? So it is possible, it depends what those diagnoses are. We have some people coming into the program with mild ASD, so as long as it's something where the young person's able to engage with the therapy, then that can be okay.
Just a note that the clinic itself offers one-on-one telehealth session for clients, including young adolescents, for a range of problems. So if this program is not does not specifically target the young person's need, they're welcome to access any of the other just a general counselling at our clinic with one of our therapists. And that's not, there is no limit on the sessions. It's not a specific program, and it's all low cost.
So John, I don't have a link to those scales, but I'm going to find a way of getting the slides to the clinic's website.
So
some other way to send those out.
We can definitely push on a link at the clinic website. If you just bear with us for about probably a week to just get that organised. So we're hoping that by this time next week on our website we'll be able to provide that link.
Yeah. Yeah, we really appreciate everyone's time today. We really appreciate it. And so I really hope that some of these ideas are helpful and people can start to use the ideas with their own practice with young people.
Yes, and please feel free to contact us if you have any questions or if you want to find out more about the program, please visit our website. And thank you, Chris, for your great presentation today and for your great work on this program. We hope that we will be able to reach many young people through it.
Thank you, Mike, for all of your support as well, because it wouldn't have happened without you. So, you know, I just came to you like at the last minute, said, oh, how about we try helping people with anxiety during the COVID-19 pandemic, and you just jumped at it and been very supportive. I really appreciate all the support you've given to this program, and the fact that that's now helping a lot of young people is just absolutely fantastic.
Thanks. And I think there is one other group that we really need to thank immensely, and that's our wonderful group of therapists.
Yes,
that work with our clients and doing
They've been brilliant. They've been absolutely brilliant. They're doing really wonderful work.
Well, thank you all.
Thank you, everyone. Thank you.